Welcome. This is our webinar about the ESRC-funded project, Influencer Stories of Mental Health and Young People. And my name is Michael Larkin. I'm a member of the project team and I'm the chair for today. So I'm just going to be trying to stitch together a really interesting conversation for you between different people who've been involved in this project in different ways. What we want to do is to provide you with a space to think about the challenges that young people face in the context of social media content about mental health. And we hope that by the end of the session, you'll have some ideas about some of the ways in which youth-led approaches might offer solutions. And on the project, we've been working very closely with young people and with people who are kind of actively engaging with mental health content in and around social media and people who are producing health-based content on social media. And we've been taking an approach that draws on ideas from psychology and linguistics and communication to think about what's happening in that space and what we can learn about how to support young people better. As we are just kind of setting up and you're joining the chat, please do have a look at what's being typed in the chat there by Andre, who's our webinar host today, and take a moment to introduce yourselves in the Zoom chat and tell us about who you are, where you're from, and why the topic's of interest to you. And if, as we go through the next hour or so, you've got questions for us, then you can post them in there. And as a team, we'll try and keep track of that. And some of them we may be able to answer in the chat, and some of them we may be able to use as the basis for some discussion towards the end. You're going to see some slides today, particularly from our principal investigator, Professor Ruth Page, who's going to be telling us about the kind of background to the project and how we learned what we learned. And those slides and the edited video for the webinar will be shared afterwards. So if there's anything that you think, oh, I'd like to revisit that, it will be available. Andre will make that available via an email afterwards. And I think those are all the main things I have to tell you before I hand over. So a key part of our project has been working really closely with young people as co-researchers. We've had a young people's advisory group hosted by the McPin Foundation, who've been a key collaborator on our project. The other institutions are the University of Birmingham, the University of Nottingham, and Aston University. And you're going to hear first today from one of our young co-researchers, Ellie Jackson, who's going to tell you a little bit about some of the challenges that a young person might encounter in the mental health content that they find online. So I'm delighted to hand over to Ellie.
Thank you, Michael. So yeah, between navigating my own mental health and having conversations with my peers, I've come to understand that the challenges young people face are often quite nuanced, complex, and difficult to navigate alone. And social media plays a significant role in this, as its algorithms are designed to reinforce the content we're most likely to engage with. And then as a result, it's incredibly easy to be surrounded by mental health related content. And I feel like once you're there, changing what you see takes a surprising amount of conscious effort, such as like purposely searching up other interests and engaging with other content above mental health. But it's still not that simple. I found that it can start with something as simple as having a bad day and you like a post that validates how you're feeling in that moment, and suddenly your whole feed is filled with similar content for days or even weeks afterwards. I think when I was struggling with my mental health, I didn't realize the impacts this constant exposure was having on me until I took a step back. It's quite widely known that mental health struggles can be deeply isolating, and for many young people, engaging with this content provides a sense of understanding and inclusion. It makes you feel seen, represented, and less alone. So in that sense, there are real comforts and positives to be found. However, over time, I began to notice a pattern. To feel understood within mental health content, the posts often focus heavily on the lowest points of mental illness. And while this can be validating for some, it can also be quite limiting and detrimental. I think young people can become stuck in a cycle of negative content that continuously reinforces the same thoughts, emotions, and behaviours. And slowly it becomes easy to believe that this is all mental health is, and that is no other way to feel or be. Personally, in stepping away from this content, I realised how important it is for young people to encounter balanced conversations about mental health, ones that acknowledge pain and struggle, but also leave room for growth, change, and hope. I think without that balance, even content meant to support us while we're struggling can end up holding us in place, usually quite a bad place. Building further on the type of content found online, one significant challenge I've noticed is the differing narratives presented by lived experience creators. Many mental health influencers, as they're often called, create thoughtful and responsible content. They share not only their struggles, but the hope, practical skills, and what life can look like beyond illness. This kind of content is especially valuable because it doesn't keep you fixated on how life feels in the present moment. Instead, it acknowledges where you are while still encouraging growth, recovery, and small steps forward. Alongside this, there's a growing amount of content that presents a very different narrative. Some creators share their lived experience in ways that seem to center on validation and, at times, some sort of glamorization of mental illness. In these spaces, mental illness can begin to look less like something a person lives with and more like something that defines them entirely. When someone's online identity becomes rooted in staying unwell, it risks sending the message that there is no life or identity beyond that struggle. I believe this type of content can, unintentionally, reinforce the experiences of the young people consuming it. For those already struggling, it can normalize being stuck and make recovery feel distant or even undesirable. Rather than opening pathways forward, it can quietly reiterate the belief that this is simply how life always will be. This contrast highlights why the kind of mental health content we amplify matters. Lived experience has immense power, but when it is shared with balance, where you can acknowledge pain, while still leaving room for hope. Thank you.
Thank you, Ellie. That was really balanced and really thoughtful, and a really good overview of lots of the things we've ended up talking about with yourself and many of the other young people on the project. A thing that really cut through for me there was about the way you kind of had to find a balance for yourself in terms of, kind of getting that validation, but also being able to access things that felt helpful. And I think that's a really powerful thing. Maybe we can come back to that, and maybe you can be thinking about whether you've got any tips for anyone in terms of what things work for you. But I don't want to put you on the spot now. So if it comes to you later, perhaps you can put some thoughts in the chat about things that you found helpful in that way, or we can come back to it as part of the group discussion later. That was a really, really helpful introduction to the experiential part of the project. My colleague and project lead, Ruth Page, is now going to tell you about the background to the project as a whole and how we did what we did. So I'm delighted to hand over to Professor Ruth Page.
This project really comes from wanting to seek to help young people navigate what is essentially a really complicated online context, which Ellie has just shared so eloquently about. The focus of this project has really been about influencers, social media figures who have high visibility, but in terms of the health content they share, it's a relatively under-regulated context. So our project really has put young people at the heart of it, but it's also taken really quite a broad view as well. So the insights that I'm going to share with you, they come from 3 sets of data that we've explored. Firstly, we analysed 27,000 TikTok videos, and we analysed a sample of comments as well, about 90,000 of them. We wanted to use this to gain a comprehensive picture, both of how influencers talk about mental health and then how people respond to that online. That will only give you a snippet of what's going on. We wanted to also be able to make sense of that and to evaluate that content from 2 perspectives. So we held 2 expert panel evaluations, one with mental health professionals, so with psychiatrists, psychologists, therapists, and another panel from experts by lived experience. And young people, as I say, have been really at the heart of this project. We've worked with the McPin Foundation, with our Young People's Advisory Group, but we've also talked with about 140 young people across this project through focus groups, interviews, holding a youth jury, and then a number of co-design workshops, listening to young people from across the UK. So what did they tell us? What did we learn from listening to young people and looking at this data? Well, thinking about how young people encounter mental health online is a really important start point, but it is, as Ellie has said, much more nuanced and much more complex than that. So firstly, how young people encounter mental health online depends a lot on their purpose. So there'll be some young people who are intentionally seeking out mental health content, and there will be some young people who are inadvertently exposed to mental health content when it is pushed to them via the algorithmic way in which some sites work, sites like TikTok, sites like Instagram, where content both comes to you and you can search for it. And that difference in platform is really important. Young people differentiate very much between the types of platforms they use, what they believe those platforms are good for, and how they will engage with it. So, for example, young people told us absolutely clearly TikTok is for distraction, it's for fun in their downtime, and if they want to learn something, then they would rather go to YouTube where they can watch long-form content. These sites also are designed with features that encourage you to either be active or to be passive in the way that you consume content. TikTok in particular tends to encourage passive consumption rather than critical thinking. And although there are a range of safety features that are there, often those features are buried in user settings rather than being obvious as resources that can be used when you're actually using the app itself in its default view. And lastly, we really don't want to generalize that all young people are the same. They're absolutely not. They are individuals, and the way that they use social media is highly personalized, and they respond to content in different ways, sometimes in different times across the same day. So all of this means that there's no one-size-fits-all solution in how we should help support them through this really complicated landscape. There are, however, some general principles that we can draw on. So firstly, in terms of what young people find helpful, one of the things that young people told us was that they found it really helpful to hear from other young people who were going through something similar to them. So stories from other young people can be reassuring. They can provide examples of how to cope with different mental health issues, especially if the person looking at the content feels some sense of connection to the person the influencer is speaking, if they consider them to be relatable. But of course, that's a double-edged sword, because what if there isn't anybody like you? And what if that range of influences is actually quite small? In the data that we looked at, there was some clear imbalances in the types of people who were sharing content online in terms of the age, in terms of gender identity, in terms of the kinds of experiences that were being presented. And this is really challenging. We really need to address that lack of diversity, and there are clear gaps that we need to fill. Secondly, absolutely, we found in our research that there is plenty of content there that is not helpful. There is some mental health content that is misleading because it's too brief and it's overgeneralized. For example, you might have seen posts like 5 signs of anxiety or how to spot a narcissist, which is trying to convey something very complex in a very, very short amount of space. And this content is risky because the mental health content can then be misapplied by the audience, perhaps applying it to somebody else or talking about others in ways that could be quite hurtful. And we know that inaccuracy, misinformation is particularly a problem, especially in relation to supplements, where supplements are being recommended as an alternative to either prescribed or more traditional forms of mental health support, especially where that's being packaged with sensationalist language, like the example that's on the screen here, and especially where that's being presented without any kind of evidence other than personal recommendation. So our panel of health professionals evaluated this kind of content as really quite harmful. Often the videos encourage a self-help approach that might isolate a person from professional help. And it's worth saying that the young people themselves who evaluated these videos were considerably more critical of that as well. In fact, the quote for today's webinar came from that expert panel of lived experience young people who were looking at this content about supplements. So there is definitely a key issue here with misinformation that we need to address. There is also a key issue around the media literacy skills that young people need. They want guidance on how to interpret and respond safely to content about mental health, because stories online can have all kinds of unintended effects. The young people in our study were cautious about the risks of accessing mental health content. They felt that even reliable content provided from a trustworthy source might still lead some people to focusing on their symptoms so that they felt worse rather than better. Other concerns related to the ways that content is connected online. So, for example, in TikTok, you can stitch videos together, and that might provoke more curiosity about the initial video and so draw a person down the rabbit hole to viewing yet more unhelpful content. And the young people in our study raised concerns, especially in relation to content about eating disorders, where even encountering positive stories from someone in recovery could at times become distressing for them. And all of this is set in a wider context where for some young people, message fatigue and past experiences made it less likely that they would follow through on the advice that might be offered. So having heard many kinds of top-down styles of communication in the past might have led them to disregard information that might be useful. Based on the evidence in our research, we know that there is no single solution to this very complicated problem, but there are three key areas we would love to see targeted. Firstly, we know that to meet young people where they're at, we really need to understand this from their perspective in ways that take into account the different ways they use different sites and their own individual responses. Secondly, we really need to ensure that those trying to support young people get the training and support that they need. Educators, families, health professionals, they need evidence-based resources to help them. And lastly, we recognise that learning how to use social media effectively to navigate mental health content is not just for schools, it's for everyone. So it needs support both in the home and within communities. So I'm sure you would like to know more about how we did this. So let me hand over to Eva from the McPin Foundation. So I'll just stop sharing my screen for a moment and hand over to you, Eva.
Thank you, Ruth. So I'm Eva. I'm a peer researcher and a public involvement officer at McPin. And the McPin Foundation is a mental health research charity that exists to transform mental health research by making sure lived experience is placed at the centre. And this is to make sure that research is relevant or meaningful for those that it intends to impact. So Ruth, could you share the slide, please? Thank you. So on this project, I work with Emma, who couldn't make it today, but we help to run the Young People's Advisory Group, which we call a YPAG. And the YPAG for this project is a group of 12 young people who have lived experience or an interest in mental health issues and engaging with social media. And we recruited this group through our Young People's Network. So firstly, Ruth, could you go to the next? Thank you. So firstly, involving young people in the co-design of mental health content is important because there's no point in creating content just for no young people to see or interact with it because it doesn't filter them or even reach them. And as Ruth mentioned, the best way to do that is by asking young people, understanding young people and our experiences, and meaningfully involving them. So at McPin, we believe that the way to involve young people in a meaningful way is to make sure that they're embedded throughout the process. So in this project, our YPAG has been involved through all the stages. And as Ruth mentioned, even the title of this webinar is a quote from a young person. So the YPAG were involved regularly. So we met roughly every 3 months. And in these meetings, they would support on decision-making or different aspects of the project. And then in between meetings, Ruth would send regular updates and a newsletter style graphics like you can see on the PowerPoint, to let the YPAG know how their input was being actioned. And we also did things like online polls and questions because it's really difficult to arrange meetings regularly. So it's important to make sure young people are involved even when you can't have a meeting. So when you're planning on involving young people, think about them from the very beginning. And then at each meeting, decision, key moment, think about how could we have young people involved here in a meaningful way and how can their voices be embedded and used to shape this output or decision. And then by giving them updates, you're showing them that their opinions are really valued. So then once you've made sure that they're embedded, it's really important to allow for as many ways and formats for them to contribute as possible. And this means moving beyond participation, so focus groups and interviews, to involvement, where young people can directly shape the decisions. So in this project, that looked like being involved in planning the youth jury. So Ruth mentioned the youth juries earlier, and the YPAG helped to plan this by making decisions on the kinds of research that we would share with the jurors. They gave input on the questions that would help to shape the discussion. They helped to film content that would be shared with the youth jury, summarizing the key findings of the study. And we even had some members of the YPAG facilitating the discussions. So it was very youth-led. And if you'd like to read more, I think Andre has shared the link to a blog I co-wrote with the YPAG on that. Our YPAG have also been involved in designing a game that will be used to help young people navigate online content. And so this involved trialing 2 versions of a game, playing it and providing feedback during an in-person session. And then we asked the YPAG their opinions, so the good, the bad, and any suggestions for modifying the game itself. And this led to the first prototype of a game that will hopefully be used in schools to help young people navigate social media. And so there's just loads of different ways that our young people have been involved. So that's from giving input on the types of men's mental health content that Influence should make, and just throughout the project, our young people have been really involved. And it's really important to know that you should give young people a range of ways to contribute, so whether that's verbally, anonymously, written feedback, and through discussion, because different young people like inputting in different ways. So in the spirit of embedded involvement, I wanted to ask Ellie, who's one of our YPAG members, what has made you feel most involved in the project?
I think one of the things that's made me feel the most involved is the inclusion of Scottish group members. I think when taking part in lived experience groups, opportunities can often feel limited if you live in Scotland, as many groups have eligibility criteria that require you to be based in England. I think this project has actively challenged that, and it has given me and other Scottish members equal opportunities for our voices to be heard through online meetings, as well as opportunities to travel to England for group sessions and workshops, ensuring that distance has not been a barrier to meaningful involvement. I think another reason I felt so involved is the way the meetings themselves are run. So bringing everyone together alongside the advisory group creates a space where contributions feel valued and taken seriously. It doesn't feel like lived experience has been included as a sort of tick box exercise, but as an essential and respected part of the process. I think that approach has made it clear that our voices generally matter in shaping the resources.
Thank you, Ellie. That reminds me of one of the most important things about including young people is that it does put more things on your to-do list and it is expensive. But it's important to make sure that it's meaningful and tokenistic. You have to really plan ahead to that, and it can be a winding road to involve young people. But it's better to plan to that and not doing it in a rushed way, and then it not have as much impact. Because even though it is a winding road, I think it's really a worthwhile road. Thank you. I think I will give it to Michael.
Yeah, thank you. That's a really helpful discussion. And just to underline how valuable all of that involvement work has been, and how much we've learned from the careful facilitation of young people's experiences and insights. I mean, you had a few things on the slide there, but we could take up the whole webinar just by describing all the amazing things we've been able to do and learn by working with young people in the way that we have. And I think the overall kind of picture is so much richer, and we have so much more to share because of that way of working. So it's tremendously valued, and I think everyone on the team wouldn't have it any other way. So from expertise about public involvement and lived experience, we're moving on to expertise about health communication. And we're delighted to have Dr. Ahmed Ezzat with us today, who is still in his surgical scrubs. So as you can see, he's got many roles, but he's coming to us today as the founder of the Health Media Consultancy and as someone who's used social media very effectively to communicate about health. So I'm delighted to hand over to Dr. Ezzat.
Thank you very much. I'm delighted to be here. It's actually formerly Health Media Consultancy, now Health Creator Leaders. And I think, so just to give you an idea about the landscape, and I think what everyone said before me and Ellie, what you stated about getting caught up in an ever-growing algorithm that's around mental health is very telling for me as a clinician, but also as a content creator. So I worked with TikTok to set up their clinical creator network, for instance, and it's interesting to see the pressures of being a healthcare professional full time, but also seeing the academia that Professor Page has put forward, and the volume of content that's being produced and the challenges that we have as healthcare professionals. And then the issue about, well, do you talk about certain subjects and how do you get the nuance correct? Because if you get that wrong, especially in younger audiences, but across all, then you end up effectively taking that whole content astray. And I've certainly had experiences where I've created content around substance misuse and I had to take it down because I realized it was propagating substance abuse, which was the whole, it defeated the whole point of creating this content. Now, some of the other things are to do with, again, trying to identify credible sources and being able to remain authentic. And, as Ellie alluded to, try and talk about the mental health conditions, but not making it all about identifying a person, like there's nothing else to talk about except that condition. And there's been a wave of content talking about mental health, simplifying it, and that is another challenge. And some of it is brought about by the simple fact that, for example, the TikToks will, pay you if you do more than 60 seconds content, but it's not going to do very well if it's 2 or 3 minutes. And that your audiences are going to switch off after probably 20 seconds or maybe 15 seconds. So you want to get that hook in play. You've also got the idea on Instagram, the challenges that some creators will have in trying to make sure that it's aesthetically very appealing, which in some respects can sometimes backfire because it can effectively glamorize, some of the issues around mental health in a way that is not ideal. And we've only just seen Ant and Dec have to take down and apologize for their podcast cover page, which depicted, imagery that could have been misconstrued and triggering for individuals who've got, some struggles with suicide or thereabouts. And this just goes to show the challenge. And then you have a big issue that healthcare professionals have, and that is around the uneven playing field. And this is across the UK and abroad. And that is that healthcare professionals are accountable to the regulatory bodies. However, non-healthcare professionals are absolutely free to create whatever content they want to with really very little in the way of, follow-up or implication. So should a clinician create content that, can cause harm, their license is on the line. They could potentially get suspended or even struck off. Whereas many creators who are creating content, especially, for example, in the supplement space, which is, of course, brings a lot of good stuff, but it's a very unregulated space and it's not medicinal, but some of the claims can be very strong. And so sometimes you may find that some healthcare professionals are not so much trying to cover all of these grounds, but because simply you are bound by your professional registrations and the implications that may have, which makes the need for this work really important. Because what currently does not exist, and if anyone's interested in this later, you can reach out, is building a community of young advocates who inform the national strategy around what type of media should actually be developed and what type of mental health awareness actually needs to be developed. So I hope that's helpful, and look forward to answering any other questions.
That's really helpful. Thank you. So that's a very good overview of lots of the things that clinicians and other content creators have to think about in order to decide how to put things together and what to communicate. And I noticed as people were introducing themselves that there are lots of health professionals on the webinar today, and some of them may have dipped their feet in this water already, and others, I don't know, they may be feeling enthused to do it and to kind of contribute to having better information online for young people, or they might be feeling a little bit worried about, getting it wrong. And I guess a thing for us to come back to in terms of top tips, Ahmed, would be if someone is thinking about joining these kinds of conversations for the first time, what would your advice be around that? But again, you can either maybe put that in the chat, or we can come back to it at the end. From the health professional perspective to the policy perspective now, and really pleased to be able to introduce you to Kadra Abdinasir, who's the Associate Director for Policy at the Centre for Mental Health. And Kadra is going to tell us about what kinds of things need to change in terms of policy in this area. So Kadra, over to you.
Thanks, Michael. It's been such an interesting conversation so far, so really tough acts to follow. But good afternoon, everyone. I'm Kadra, and I work for Centre for Mental Health. We are a national charity focused on influencing policy so that decisions about mental health by the government, by mental health services, are shaped by the best possible evidence, including and crucially the lived experiences of young people and marginalised groups. So today, I just wanted to briefly reflect on the changes that we still need to see in policy when it comes to social media influencers and young people's mental health. We know that currently around 1 in 5 children and young people report a common mental health problem such as anxiety and depression. And this has been up from 1 in 9 just before the pandemic. Recently, there's been such a big growing public debate about whether this increase is happening because there's an overdiagnosis of mental ill health. And part of these discussions have also touched on how it might intersect with social media and influencer content our young people may be over-identifying because of the information they come across online. From our point of view, this is why we really welcomed the government's announcement in December of an independent national review into what's really driving these rising rates, rather than amplifying some of the stigmatizing speculation that we've seen in the press over the last year or so. What we need is really careful, evidence-led understanding of the role of social media, including influencer stories. So that's why this study is really important. Recognizing both the potential benefits that both Eva and Ellie touched on, such as validation, awareness, and also the risks such as misinformation and harm. Screen time and social media, I think in general, and especially topical in the news this week, are often presented as the cause of young people's distress today. And some people have already commented on this in the chat, but there's a live debate about banning under 16s from social media altogether following Australia's recent ban. Over the weekend, however, we did see that there was a coalition of organisations, including the Marley Rose Foundation, NSPCC, and many others, who have publicly expressed a concern about a blanket ban. We agree actually with their calls on policymakers to really listen to children and young people and look at the full range of evidence that's available. We know that children and young people's mental health is clearly getting worse, and digital world is likely part of the picture, but it's not the whole picture. Our work consistently finds that rising levels of inequality, academic pressure, fewer opportunities to play and connect offline, and discrimination all play a role here. If we rush to decisions without really fully considering the problem, we are risking increasing young people's isolation and disempowerment, really. So what we need is a cross-government coordinated response to rebuild children's mental health, which should include stronger safeguards online, building on some of the principles and learning from the study, which Ruth touched on earlier. There are also some challenges we've seen with broad public campaigns over the years. For example, the government published and launched the Every Mind Matters platform to provide trusted mental health information and signposting. It was great at the time to see them also involve social media influencers, such as the former Love Islander, Dr. Alex George, who was appointed the government's ambassador on young people's mental health. But still, we know that awareness and reach remain uneven, particularly for certain marginalized groups. So many young people, as a result, are still turning to social media and influencers, which makes quality and accuracy of their content really important in this context. I also wanted to touch on educational settings because we believe they've got a critical role to play here. we've long been advocating for a whole setting approach to mental health and well-being from early years right the way through to higher education, and that this includes both media and mental health literacy as core skills that are nurtured throughout the curriculum and not just seen as a one-off session here and there in relationships and health education. Young people need that support to help manage their mental health, but also to critically navigate online content, stories, and the advice as we've heard. Looking ahead, there's also a big focus at the moment around AI, which presents both risks and opportunities as well. I've got my little burner TikTok account, and I've already seen that there's a huge amount of AI generated content, some of it helpful, some of it deeply misleading. And I think also thinking beyond misinformation, there's concerns around disinformation that is being pushed out there in these domains. We know that also young people are increasingly turning to platforms such as ChatGPT for advice and information, and maybe using content generated from there on social media platforms. So I think for us, it really raises some important questions about how we develop purpose-built, evidence-based, and safe digital tools, and how this should supplement and be alongside relatable, effective, user-led content on social media platforms so that young people can access that trustworthy support rather than having to navigate a really crowded and unregulated space alone. So just to close, I think, ultimately, we know that influencer stories can play such a powerful role in shaping how young people understand their mental health, but this must sit alongside a wider system of support that values prevention, community, education, and crucially, young people's own sense of agency. So thanks everyone for listening and looking forward to discussing this more. I think I am going to actually circle us back to a question that I had for Ahmed, if you want to start with this one, and I'll come to you then, Kaz. What is one key change that you would like to see happen as a result of everything that you've heard today? Ahmed, if you want to start.
Thank you very much, Kadra. So I think listening to everyone, their mental health specifically, there needs to be some safeguards, and there needs to be some very clear signposting by social media platforms, along with some pressure from government and from mental health charities to ring fence actually who can speak about mental health, including healthcare professionals. And I say this because the implications are very significant. And it's not like, and I agree with you, I don't think it's acceptable to find people jumping on a viral bandwagon of, 5 ways to spot a narcissist husband, wife, daughter, son, whatever it is. I think that is what my view would be.
Thanks so much, Ahmed. Kaz, can I bring you in?
You can, yes. I think one big change I'd like to see is more positive and proactive content about mental health online. And I think a lot of it by young people, for young people, that promotes well-being. I think social media companies really have a responsibility to be pushing and facilitating that content. And there's also a responsibility on the government and the regulators as well to be making sure that mental health is being talked about in a positive and proactive way.
Brilliant. So, Kaz, I think I'm passing back to you as well to tell us a little bit more about what young people can do to flip the narrative. I think you had a few thoughts on that as well to share.
So I'm Chu-Foon, and I'm a young activist, and I'm the educational lead digital rebel at FlipGen CIC. We're all about no tech, as in with a K, and not no tech. So really coming back to what you've talked about with that ban on social media for under 16s and how not everyone necessarily agrees with that. We are really about educating young people on technology, on social media, and how to use it safely. So I'm going to talk to you a little bit about championing and centering youth voice and how it's pivotal in flipping the script and combating the challenges that young people face when they're utilizing social media or influencers as a mental health resource. I know this is something that has been sort of touched upon throughout the webinar. It's really a privilege to be speaking here with so many real professionals and experts in their field. I've only been working with FlipGen for about a year. I'm 18. I've witnessed and participated though firsthand in this year in how young people are changing the narrative around social media influencers and mental health. So I think the picture can seem pretty bleak at the moment. So many young people feel the need to resort to social media and to influencers who may not be entirely reliable. They may be swayed by certain products. They maybe have their own personal incentives and using that to seek mental health help. But it isn't all that bad because we know also social media has the immense power and influencers have the immense power to be harnessed essentially for good. And that can be used in order to uplift young people and give them and signpost them towards the proper support that they need in a form which is easily accessible on social media or online, rather than, as we know, the struggle that it is for a lot of young people to access mental health support, say for the NHS. At FlipGen, we recently did a series of videos you can find on our socials, sort of advent calendar kind of videos in the run up to Christmas. So every day, one of our digital rebels, which is the young people essentially on our youth board, would film a video with the tip of the day to promote well-being in the festive season. We know this is a period of time a lot of young people can really struggle with, whether it's seeing some family where you have some conflict with, or I think often it can be that sort of seasonal depression that a lot of young people get. So it was really good to kind of push a little bit of advice, a little bit of mental health well-being advice when you have so many of these influencers who maybe aren't necessarily reliable, and to push again that positive content on social media. There is power in educating young people also on the digital world and how the content that they consume affects them and how they feel a lot more intimately than they might realize, and how influencers may not, again, always be truthful nor suitable. Simultaneously, again, there's power in consuming the content. Youth-informed and youth-delivered approach, which we really bang on about until the cows come home at FlipGen, to digital mental health resources is equipped with the insight and the understanding, and I think the nearness that encourages young people to listen and directs them to where they need to be, improving our well-being and our experience. We do this a little bit through our digital intelligence toolkit, for example, which was created with young people for young people. It's more of an sort of educational in schools approach, but it's a comprehensive guide on navigating the digital world, and it intends to help educators, youth workers, anybody that sort of works with or supports young people to educate and support in how they're consuming this content, which could potentially be harmful or biased. Also, I know what it's like to be on a sort of hole in social media. As Ellie mentioned at the beginning of this webinar, a sort of mental health slump where you find yourself endlessly scrolling and steeping in your own misery, sort of through other content from other struggling young people often, or struggling influencers, which is repeatedly consumed and ultimately can encourage some really unhealthy practices, disordered eating, self-harm, substance abuse. And the truth is that social media companies do not care nearly enough about young people and their mental health. We're seeing big steps being made, but mostly they are in it for the profit. And I think that's really important to remember when we're trying to lobby these social media companies to do more for mental health. Ultimately, they care about keeping young people on the platform and for the algorithm, even if that means that they're engaging in really unhealthy or really dangerous content. But the great thing is, obviously, we have the power to be pushing this positive, informative online content by young people for young people that connects, understands, and empowers. And we can build a better digital world where positive content is redirecting and uplifting and helping young people to escape the doom loop, essentially, of negative content. And this is exactly what so many young people are doing, not only at FlipGen. I don't know if you've heard of Beyond, which is an amazing youth charity we're doing an event with on Wednesday at the Bet Show in London. Design It For Us Coalition, The Mix. There's so many organizations and initiatives in the UK and beyond who are helping to uplift young people and centering young people in this vital work that's being done on mental health and influences. Social media constructing like sort of youth-informed approaches, and nonetheless, though, it's really important that we have research like this going on, which is, again, as we love to see, centering young people, supporting them, platforms, institutions, education institutions, industry leaders. It's so powerful and so important. And I think we're really going in the right direction. Thank you.
Thanks very much, Kaz. That's really a nice, strong, positive note to end on in terms of like building a better digital space with young people. I think it's really nice to see that as the way forward here, and it's aligned with quite a few of the questions and comments that have been coming in the chat, and it's certainly followed on really well from what Kadra was saying. We've got a little bit of time for some discussion, so we can come back to a couple of the questions that we've raised along the way, and one of those was about perhaps top tips for kind of managing your online experience around mental health, and particularly prompted by Ellie's description at the beginning, but other people may have thoughts about that. And another question I had was, top tips for new creators if we are to work with young people to create better content. How should we start? There are also quite a few questions in the chat. Andre's has forwarded some of those to me. So one is asking about how to avoid harms when we're designing resources. Maybe we just kind of see what initial thoughts people want to come back to first, and then I can follow up with some more questions. Anybody got tips or reflections they'd like to share?
Can I jump in?
Yeah, please.
So in response to the question about where do you start in terms of maybe working with influencers or designing content for young people, I would say, based on the experience of leading this project and working with young people, the thing is, young people are not all the same. And so it's really important to understand who it is you're trying to talk to, and listening to them and understanding what they find hearable and engaging. So doing a little bit of audience research first is really, really helpful. And for me, that also brought to light some of the things that might have been distressing that I would not have considered distressing. And so doing a little bit of pilot work, if you possibly can, with a group of people who are in that group that you want to reach, is a really great way of going about it, because I don't think there is one single guide that we can have that will work for everyone. Yeah. So that would be my top tip, is do a bit of audience research first if you can, by which I mean even just a focus group or some way of listening to young people and what they would find helpful would be my top tip.
Thanks. And there's a question from Maristel Priest in the chat, which is, what are your views on the role of local mental health services in this space? And should we be actively creating content with children and young people in the hope it will reach them? And I think that follows on really nicely from that, Ruth, in that local mental health services are an advantage because they've already got relationships with young people. They probably already have lived experience advisory groups that they can collaborate with. And they have a community of young people out there with lots of questions about mental health and about what's available locally. They probably don't know what inpatient services look like unless they've been there. They probably don't know what the first consultation is going to be like unless they've already had one. There's lots of really good, useful information that varies locally that I think people could be kind of putting out there, that in my head I imagine that would be really useful. I don't know what, you're nodding, Kadra, so I'll maybe see what other people think.
Yeah, happy to just share like an example I've been involved in the past year in South London here. So some of you might have heard about the mental health support teams in schools. This is a program that's been rolling out nationally. In South London, though, despite it being a very diverse geographic area, the representation wasn't translating into who was accessing mental health support teams. So I was working as part of a community team to co-create content with young people, some videos, some podcasts, some radio interviews locally, to kind of bring to life what mental health support teams are all about, demystify them a little bit with young people. What type of issues can they help you with? Where do you access them? All that kind of stuff. And I hope that this will help make a difference, because I think at the moment it just felt like, again, this is another thing that is very much part of the mental health system. It's not for us, it's too clinical. You're going to need a referral, all of these things that kind of put young people off from seeking the support they need at the right time. So it can be done. And I think they really recognize the value of co-creating those resources with young people. So I hope over the next coming years, it's going to make a real difference and shift those trends that we see.
That sounds brilliant. It sounds really good, because the NHS is really good at producing generic information about different kinds of diagnoses and symptoms and so on. But if you want to know what your local provision is like, or what it looks like, or who you would see, or how to engage with it, you Google something and it takes you to the kind of a website that's 20 years out of date. It's not great in terms of its digital presence at the local level. So those kinds of things would be amazing, wouldn't they? There's a question from Lucy Hitcham. Did we discuss the role of the Online Safety Act and how our research might feed into that? I imagine, Ruth, you've got something to say about that.
Yeah, well, we actually didn't talk about it in our Young People's Advisory Group meetings, but as a team, we have talked about it, and we have talked about it with MPs. We submitted evidence to the independent inquiry that happened about media literacy, and we have a bunch of policy briefs and materials that are actually on our website. So I popped that in the chat, but we can send it out to everybody afterwards. The Online Safety Act is complicated. I think my feeling about this is that it will touch certain kinds of harms and will provide protection at certain kinds of levels, but it won't touch the grey area. And it's the grey area that is really complicated, and it's difficult to legislate for. There are some things I think we could legislate for. I think we could push for something like the patient information. Is it patient information forum? Did I use the right words, Andre? The PIF-TIC, which does work like a kind of verification, a kite mark that is recognisable for health professionals. We could push for something like that. But there's a bunch of grey, complicated area out there as well. A lot of harm that's not governed by those primary harms. And that's where we really need to bring in the piece about education and about empowering and about agency. And yes, we need to have guardrails up 100%, but we absolutely 100% need to empower young people to educate and to be educators, to know how to use this space well. In our project, that's been about creating this educational game that's been mentioned. We will have that online, and we can send it out to you if you're interested as well. So if you are interested, please put your name in the chat and we'll send you the game. So it's about, yes, we have talked about it. We've got some materials there. Please do read them. But we're really interested in trying to take a holistic approach as well, to go beyond what the Online Safety Act is going to be able to do.
Ahmed, you'd like to come in here?
Absolutely. I was just going to echo what Michael had said about the your role in community setups or hospitals or trusts. There is a wealth and abundance of expertise that is unparalleled. The way I view creators or myself is, and we bring about a lot of good, but think of it as the black market. Effectively, there is a huge segment of the actual mainstream that can absolutely create an abundance of content with actors who are lived actors, who are patients, who may not all be, 12-year-olds, some of whom may be capable of creating this content. And it makes it so relatable within context, within the settings that these individuals will reach out to and require services within. And so please, if there's anything from my perspective, it's, yes, creating content as a creator, as a clinician is great. But really, it's about trying to empower you as organizations at an organizational level to build out a policy of creating this wealth of content. Because the whole premise of it is it's authentic, it's believable, it's easily consumable, and it's not jargon heavy. And that's effectively what the mantra of all of this is. So, if you're interested in any of this, I think Prof. Page has been an absolute beacon of light in this, and would also love to hear from you and everyone else, of course, that's been in the call.
Thank you. Maybe we've got time for one or two more. I'm just looking on. Yeah, we're okay. So there's a question from Dominique Thompson. Really interesting question. Is anyone researching the negative experience or impact of being an influencer? So I suppose particularly in terms of some of the ways in which posting about one's lived experience might have negative consequences for some people. Yeah, do we know anything about that, Ruth? Is that something you've come across?
Yes, we do.
Yeah.
It's not something that we've particularly covered in this project, but actually there has been some work over the last couple of years. It really began with the independent influencer inquiry, was back in 2022, in fact. So there was a report that documented some of that already, that actually, yes, we're absolutely concerned about the harms for people on the receiving end of materials that are not helpful, but actually influencers themselves can be on the back end of really receiving very difficult situations. So yes, there is research that's been done about that. Interesting research being done about the legal side of it, of children, families, and the harms that might come to the children of influencers, family influencers who are putting their children's lives online, and what that looks like. So yes, there's research that's being done about that as well. I don't have the actual papers to my fingertips at this point in time, but if you, that is in the chat, isn't it, with a specific name against it? So we can either put that together in a document that can go out to everybody after, so I can individually email the person with the specific studies that I know of about this topic.
Thank you. Now I have to read without processing what I've read. So there's a message from Judy Sutton here. Hello, Judy. Used to work with Judy. So I think this is in response to Kaz. I love the idea of flipping the narrative and would love to hear if young people have ideas about resisting ideas about mental health labels and diagnosis being the way to get help. I see lots of young people in CAM services who ask for diagnosis, and I talk with them about understanding distress. It doesn't always land. I explore the resources already mentioned. Don't think this is a quick question, but any thoughts around labeling, diagnosis, whether they're always understood to be helpful or desirable?
I think one thing I would definitely say is, and as someone who has quite a lot of conversations with young people about social media and mental health, is a lot of the content you see tries to, and I think this goes beyond mental health, fit you into a tiny little box. So people really want that box to fit in, just to say, like, okay, I have anxiety, I have depression, for example. Like, they really seek that diagnosis because it gives them that sense of belonging in that community, in that space, maybe around that disorder, around that struggle. And it makes that advice that they see on social media, I think, feel really personalized. So if they can go get a diagnosis and say, okay, well, I have anxiety and I'm in all these spaces with all these other people with anxiety on social media, and they give me all this advice and they tell me all these things. I think furthermore, a lot of content on social media attempts to sort of self-diagnose people, or sort of encourage that sort of self-diagnosis. And then people seek that validation and validating that sort of self-diagnosis from all this social media content and all this really simplified, I think, content on mental health and the mental health disorders. They sort of seek that affirmation through actual mental health services. I'm not sure how helpful of an answer that is. If you do need me to elaborate, I can.
No, I think that is helpful. And it's making me wonder whether Eva and Kadra might have things to say about community building there that we could just pick up on before we close. Did you want to just come in there, Eva? Yeah.
Yeah, what Kaz said reminded me of how sometimes people seek labels because they want to feel part of something and they want to feel seen and heard. So I think emphasizing the importance of it, if you're struggling, it doesn't matter what the label is, but you deserve to seek support and you deserve to get help. So it doesn't matter what the label is. If you're struggling, seek help. And I think that's the most important thing to drill into young people.
Yeah, super quickly, I would just really echo that. I think part of this whole debate around overdiagnosis, one of the challenges is that diagnosis has become the gateway to support, and it doesn't have to be that way. Unlike physical health, I think we really benefit from such a broad range and sources of support when it comes to mental health and well-being that we need to tap into. So yeah, whilst I can recognize it's really affirming for some people, you shouldn't have to have it to get the support you need. In the same way, when you go to your GP, you don't necessarily get a diagnosis straight away, but you do get support, information, and advice. So yeah, I really hope that the prevalence review that's going to be underway this year really engages young people to hear these nuanced perspectives.
Thank you. And I think we need to draw to a close now, don't we, Andre? So just thank all of our contributors for their very thoughtful and insightful part of the conversation today, and remind you that you'll receive slides and links and other material as a follow-up, and that if you want to find out more about the project, keep track of the website. There's other events and lots of outputs from the project to follow. And a short exit survey will pop up when you leave the webinar. So please do take a minute to just give ourselves and the mental health a bit of feedback about the event so that we can learn about future things that we could do. Anything else you would like me to say, Andre?
No, that's perfect. Thanks so much, everyone. That was brilliant.
Thank you, everybody.